So it's the most complex detective investigation matter. We had a meeting amongst all of us. We came up with an operating protocol and an action plan. The Lawrence Hospital, which is the first hospital that the lawyer went to, is having 8 employees tested. The SAR High School is going to be closed until after Purim, which is next week. The individuals there are going to self-quarantine through Friday. If they have any symptoms, they'll call a health professional, discuss the symptoms, and then the health professional can decide and recommend whether or not they should be tested. The synagogue is going to be closed until March 8th, which will be 14 days from the initial convening, and those individuals will be on self-quarantine. The SAR Elementary School will be closed until Friday, but with no quarantine. And then the Yeshiva University will be closed until Friday, and we'll assess the situation up until Friday. Yeshiva University obviously involves many potential students, so a decision there will have a large consequence. So it'll be closed until Friday, and then we'll make a decision Friday. That's the good news. The not so good news is that there was another person who was being tested who came in contact with the 50-year-old lawyer, a friend of the lawyer's who he spent time with and in close proximity in a number of situations. That person also tested positive. We then tested that person's wife, 2 sons, and daughter, and they all tested positive. And those children attend the West Torah Academy, which coincidentally is one of the institutions that was at the meeting with us this afternoon, where we decided the protocol there was they would be closed until Friday. Obviously, we'll have to reevaluate that in light of this new information, but they're closed until Friday anyway, and they have the people in Torah Academy on notice that they should be looking for symptoms. If they don't feel well, call the health professional. But that is another 1, 2, 3, 4, 5 people. And again, all off this one attorney, 50-year-old, who is the only person to date who was hospitalized because he also had a respiratory illness, and we said that is the target problematic population, right? Senior citizens, immunocompromised or underlying illness, and especially an underlying respiratory illness. Anything to add, Doctor? No questions? Okay.
Another family, 5 people, father, mother, 2 daughters, 1 son, you said? And so what about contacts that they've had?
2 sons, 1 daughter.
2 sons, 1 daughter.
They are in the West Torah Academy, which is where, if there are additional contacts, it would have been through the West Torah Academy. That West Torah Academy was at the meeting we had in Westchester vis-a-vis the lawyer's family, and we decided that they would be closed until Friday. So they were going to be closed until Friday anyway.
Did the patriarch and that family go into the city? Do they work locally? Do they work?
We don't know. We have to track that down now. Do you know anything?
No, we don't, but this is the investigation which is now ongoing. Once we get a positive case, now we investigate that case and anyone involved with that case.
They're isolated at home?
Does this family also live in New Rochelle?
Yes.
And earlier, we had talked about the condition of the original New Rochelle man who's still in the hospital. I think at one point, you may have said critical condition, at one point stable. Are those mutually exclusive?
So I think a lot of people ask this question about what's critical, what's stable when you're in ICU. I mean, when someone comes into intensive care unit, they're obviously sick enough that they need interventions pretty quickly. But then, after those interventions are put into place and things are quote, quieted down, unquote, then you could say they're in stable condition, and he's in stable condition, but still requires support.
So is that critical but stable condition? Or, I mean, what's-
He's in stable condition in an intensive care unit.
I think it's also fair to say that his condition has improved. Is that-
Yes, and his condition, yes, that is correct.
I mean, is there concern of possible death still?
Well, the thing is, as an ICU doctor, I could tell you that, when anyone is in an intensive care unit, things can always change. But the fact that he's improved is a positive sign.
Doctors give no guarantees, by the way. If you're asking a doctor to give you a prediction or a guarantee, it's not going to happen. Let me just clarify this. There were 4 children in this family, 2 sons, 2 daughters. 1 daughter is negative. So the 2 sons are positive, 1 daughter is positive, 1 daughter is negative.
Total of 10 confirmed cases in New York State, and they all stem from this individual with the exception of the healthcare worker?
Yes.
Under state law, what's the difference between self-quarantine and mandatory quarantine? And what would put you in either one of those brackets?
There's mandatory quarantine. Self-quarantine is really a term of art. It's not a legal term. You voluntarily will isolate yourself is actually the term. So you can do that voluntarily. If you say, no, I don't want to do that, and the state believes there's cause for you to be isolated, or you're a risk to public health, then the state can issue an order directing you, which is mandatory quarantine. But if you say, I'll stay home, we call that self-quarantine.
So what kind of symptoms would an individual need to exhibit that would say, hey?
You don't have to exhibit any. If you were in close contact with a person who is then known to be positive, we would ask you to quarantine yourself for 14 days.
Are there penalties if you don't follow either self-quarantine or mandatory quarantine?
There are penalties if you don't follow mandatory quarantine.
What would those be?
We can enforce the quarantine or isolation. If the state says you must be isolated because you pose a health risk, the people who test positive here, we say they are self-isolation, self-quarantine, which they voluntarily said, yeah, I get it, I'll stay home. I don't want to infect anyone. If they said, I won't stay home, and I plan on going to a ball game today, and I'm going to a concert, and I'm going to go up and down and ride the trains, the state can direct that they be isolated.
So then would someone be on guard? Like, would you have police or hospital?
It normally doesn't go that far. I don't know that we've ever had a forcible isolation, because people, if you've been exposed, you're going to be ill, you don't really want to be running around the town anyway.
Governor, what role does the state play in determining contingency plans or school closures if a teacher or student has been exposed to coronavirus or is showing symptoms of the illness?
Well, option A would be you get another teacher, right? But if you had to close schools, you can close schools. Washington closed schools. You have schools that are closing here.
Or would you need to, or the executive's office need to step in and say, this is the protocol for closing a school, we need to have someone test positive in it?
There is the same issue as on the isolation. For example, you have schools that are closing here. The SAR school is closing. Yeshiva University is closing. That's a university that's closing. We did that cooperatively, and we had a conversation, and we talked through the facts, and they agreed to close. If they didn't agree to close, and we believed that it posed a health risk, we could direct the closing of the school.
Governor, do you see how many people are quarantined right now, and additionally are being tested statewide?
Now, quarantine, this is where, getting back to Bernadette's question, voluntary voluntary isolation. People who were in the synagogue, students who were in the class, where they are voluntarily being isolated. What would you say the number?
There are hundreds that we have across the state.
Hundreds.
Say 4,000 Westchester earlier today.
No.
It was 1,000.
I'm sorry?
It was 1,000 that you guys said earlier, and that was everyone.
So there's hundreds that are quarantined statewide, you say, or across the state? Hundreds statewide.
No, there's more than 100 statewide. Voluntary quarantine. We have to get the numbers. There are going to be hundreds in Westchester.
What is your message for people who either live in New Rochelle or might want to visit New Rochelle? Or it seems like these are Jewish families who are active in kind of Jewish institutions. So are there people who should be on edge? What's your message to them? And should they be taking extra precautions?
Well, either, this happens to be just the circumstances of this situation, right? This family, we had the healthcare situation, which was the exact opposite of this. Two healthcare workers, they took all the precautions, they came off a plane, they knew to self-isolate, if you will, because they were healthcare workers. This is the exact opposite. This is a gentleman who's practicing law. He goes to the city, he practices law, he comes back, his kids are going to school, and you see how quickly you touch hundreds of people. It's just in life, right? So we are trying to do as much investigation work just to notify as many people as possible. Containment strategy. It's impossible to really contain it, but you're putting more people on notice, et cetera. But it's just a function of circumstance. You know, this could have happened anywhere. It happened in New Rochelle, but it could have happened anywhere, and it will. And it will. The number of people infected will continue to increase. It is a function of mathematics. We're now playing this game, oh, one here, one here, one here, whack-a-mole. It is going to be dozens and dozens and dozens. Just take any one of these situations. The person went to a bar mitzvah and talked to 100 people at the bar mitzvah. 100 people go home, and they have 5 people in their home. His one friend goes back, infects the wife, infects the 2 sons, infects the daughter. That one connection. That is going to continue to exponentially increase. Well, what can you do about it? You can try to limit the spread. The good news is, remember, if you are infected, what does that mean? That's really the bottom line question here. And 80% self-resolve. And 20% may get seriously ill, may require hospitalization. And a very small percentage, seniors, immune-compromised, people with underlying illnesses, could face real danger.
I just wanted to add one point about the second person, because the first person traveled, and we knew about travel advisories, we knew about the fact that they came back from Iran and they did exactly what was necessary. The second person was the first community spread. So why would someone initially think that they could have a cold, they could have a fever, they could have the flu? So why would they think that suddenly that they had coronavirus? Now that we realize it's in the community, people will look at it a little bit differently. And so he went and saw his friend, he spent time with his family, obviously. Just
That is the balance, but that is the doctor, and I talk about this, that is the balance. You want people to be aware, so you are cautious, and you're more cautious than normal. If you had a flu, and you were catching the flu, you'd probably go to work anyway. You'd probably go to dinner with a few buddies. I just have a touch of the flu. That's how you would normally react. This will feel the same way, but we want you aware that it may not be the normal flu. It may be the coronavirus. So you take a heightened sense of precaution. That's what it is. But the balance is, that's the positive message. The balance is, don't overreact and get too anxious and too fearful. And I think the culmination of all these communications has actually created a fear factor that is complicating the entire situation.
Plan for what New York will do in a worst-case scenario. Would a certain number of cases trigger, that sort of worst-case scenario? Would we see things like drive-throughs, where you can get tests like in other countries? What sort of,
Drive-through tests. What do you think about that, Dr. Zucker? Drive-through tests. Speaking to the microphone.
Well, I think that what will end up happening is if we need to do more tests, this is why we're revving up to be able to do this at hospitals, labs, and if necessary, we'll adjust accordingly. We don't want people to feel that they can't, they'd have to stand on some line to get a test. We're going to work on making sure people are tested based on what their physician, nurse practitioner suggests.
We have, first of all, we're calibrating. You have to calibrate your capacity to do tests with how many tests you offer, right? We started this week. The capacity to do tests was like 20 or 30 tests per day. So you can't be doing a drive-through if you can only do 20 or 30 tests per day. We're working to increase that level of testing, which is very complicated. And our goal is to get to 1,000 tests per day. But that's still only 1,000 tests per day, right? So you can't just randomly test, and you can't test just because a person has an anxious personality and I want to take a test just to be sure.
how many tests are we at?
Can you confirm where this new family lives, where they work?
New Rochelle,
Do they commute to the city for work? Do we know?
that's all we know now.
And what about their condition?
I don't know if they commute to the city.
How many tests are you going to do right now?
Say it again?
Have they done on public transportation any of them?
That's what we have to find out.
And their condition, can we know their general condition?
No?
They are at home.
Are they showing symptoms?
Yes, they had symptoms.
But again, that's an important point. They're at home. We have to get out of this headset. Oh, I have a coronavirus. That's a dire situation. These people are at home. The other people are at home. There's only one person in a hospital, which is the lawyer who had the respiratory illness. Everybody else is at home, sort of like you had the flu.
How many tests can the state do right now?
We're at about 200, ramping up.
What about the SUNY students coming back that you were back? Are you working with campuses and the families at all?
Are we waiting? I'm
Are
sorry?
you working with the families and the campuses at all for the students who were back?
Yes. You want to
Yes.
speak to that?
Yes, we are working with the campuses and with the families to make sure that the students have everything that they'll need upon their return.
So are they going to be quarantined as well?
Yes, we are going to keep them in the dorm setting for 14 days.
And just to confirm, it's 10 confirmed right now, not 11, because I think we got something from your press office saying it was 11.
Press office, you have to proofread what that press office, how many, is it 10 or 11?
Well, but this new family, is this family the gentleman who drove?
I'm sorry, I'm sorry, go ahead.
Is the plan the same?
But I said to ask the question, you have to jump in that minute,
gotta be more aggressive.
because they are piranha, they will come right in if you don't fill the void.
It's true. Is for private students also coming in overseas, is the plan the same for SUNY and CUNY students?
A number of the private schools had already been bringing students back in the weeks prior. We've been contacting them to make sure that we know exactly where those students were. If they're from the level 2 and 3 countries, then we're going to make sure that they are practicing good home isolation practices as well, so they will be quarantined in their homes. We're going to be following up with the State Department of Health and those colleges to make sure that we're making those connections to monitor those contacts as well.
What's there to suggest that the lawyer was the one to have passed the virus to others?
Because
Maybe
there
not
was
the other way
his
around?
friend, and he spent time with the person, and the person was identified as his friend.
Is there any projections at this point or models that say how extensive this is going to be statewide?
Well,
All right.
Well, I think that the issue is not just statewide, it's how extensive this will be on a national level or global level. and we're still trying to learn about that.
You don't have numbers for any of it, then?
Not yet.
You don't have an idea of how many people might be infected?
Well,
based on-
I think what the governor mentioned is that there is communal spread. There will be more community spread. The fact is, we do know some of the epidemiology of how one person can infect several people, and you could try to model from that, but it's still new here in the United States for us.
Let me just expand on what the good doctor said, because I know nothing about medicine and therefore I am not inhibited by my lack of knowledge. If you look at the numbers, it has to go dozens and dozens and dozens. It has to. This one case, just look at the pyramid. One attorney, we're now talking about what? 500 people possibly? But, just follow the tree. It will be dozens and dozens and dozens and dozens at a minimum. So that's why, don't confuse the two concepts. We're investigating every case, but they're going to be dozens and dozens. Well, then why are you investigating? Because to the extent you can limit and contain, do it, understanding that it is impossible to contain, right? Because you're literally trying to contain air. You're literally trying to contain the droplets in a sneeze. It is impossible to contain. But do the best you can, awareness, limit, put people on notice.
So I understand your situation, but I'm trying to get beyond dozens and dozens and dozens. I mean, it seems like what you're talking about, especially one person, 500 possible contacts here. We're talking about thousands, and I know there's modeling that's done, and the doctor mentioned that, but it just hasn't been
Go
done
out on
yet.
the limb. I'd make a prediction if I were you, a number, and I'll wager you on the number.
Well, here's the way I look at it. When you have a cold, just a regular cold, you go into your office, right, and you say, I'm sick, and the next thing you know, 5, 10 other people are sick in the office. You go to school, your family, your kids get sick, you get sick. So it is highly likely that this is going to expand, as the governor said, in an exponential way. I can't predict whether it's going to be X number of millions in the state of New York or not, but I will tell you that just looking at it from the standard of a cold, that many people in the community in higher percentages will get that cold. This is what happens every year, and we see it on a regular basis, and you could just look, and colds are coronaviruses, different type of coronavirus, but they're coronaviruses. So you could say it's going to act the same way.
We have 15,000 people in hospital beds today with the flu. 15,000 in a hospital. Sir?
15,000 or 1,500?
15,000. Do you have trouble hearing me?
Executive Jim McCoy this morning addressing the coronavirus in Albany. Do you feel it's just a matter of time before the coronavirus does arrive here in Albany?
I think you do everything you can to limit the spread, but I think it's just a matter of time before it continues to increase. The only question is how far it increases. And we're doing everything we can to limit the increase, but again, it's literally like trying to stop air, because this is, somebody sneezes, it's respiratory, and it's inevitable that it will continue to spread. But people being aware, people taking precautions they don't normally take just for the flu, staying home when normally you would go to work, getting a test when normally you would say, well, I'm going to take 2 aspirin and go to bed. That awareness is very helpful. And then specifically tracking down a case and going to individuals and saying, by the way, this person had it, were you in contact with this person? So they're really on notice. And the quote-unquote quarantine is, and stay home. Don't go to work, don't infect others. We want you to isolate yourself, which we don't do with a normal flu.
Since the number of cases is going to exponentially grow, it's inevitable, how do you figure out who to prioritize in terms of testing, since we're only up to 200 and we'll ramp up to 1,000 a day?
So a couple things. One is you obviously will prioritize those who are at highest risk. So that includes the elderly, the immunocompromised, and others in that category. And then I think it's important for the patient to talk to their doctor and let them use their good clinical judgment, evaluating the patient themselves. They may have some other medical conditions that warrant a test that would make them more at risk for getting infected.
So when should a healthcare practitioner sort of raise a red flag to higher ups, say, we might have a possible case here?
Well, I think that is very case specific. I wouldn't want to make a generalization to say that all healthcare professionals should do X or Y when it comes to testing. I would just want them to use their good judgment, and particularly knowing the patient that they care for. That's the most important. That's why the doctor-patient relationship is so important in this situation.
But they ask the appropriate questions. If you went to a doctor, first of all, they know the anxiety is very high, so a lot of people are very nervous. Where have you been? Were you on a plane? Did you travel to one of the countries that's problematic? Test you for the normal flu? And if they eliminate everything else, this would probably be, then they would get to the point where they would ask for a test.
Well, since there's community spread now, wouldn't the first question as they travel?
Well, you're still more probable. If you said, I was in Italy 2 weeks ago, that's demonstrative here.
Governor, any further assessment on how the federal government has been handling this and reacting to it?
You know, the response is primarily handled by the states. And the CDC made that clear. You know, the CDC gives guidance. They'll give guidance to the Department of Health. But the state is responsible for actually addressing and managing and handling the operation, right? You don't see CDC personnel running around the streets.
Governor, if you were to issue an emergency order, would that also cover New York City? And in which case, would that empower health officials to isolate and quarantine people in hospitals?
My jurisdiction is statewide, right? So I don't understand the question. Could I do an order vis-à-vis New York City? Yes. And then what was the second part of it?
Would that allow health officials to isolate and quarantine people in hospitals?
You can isolate people in hospitals. Yes, we do isolate people in hospitals. Now,
Just a clarifying question. We have the family of four, the 50-year-old attorney and the wife, the two daughters, the two children. We have the man who drove that guy to the hospital. He's infected. This family of five, does that stem from the driver, or is it a third family?
A friend of the person who's in the hospital.
And not the friend who drove?
No.
So we have three families here in Westchester?
yes, if you want to say the friend is a family, yes.
Do we know how the lawyer got it in the first place?
I'm sorry. If you want to say the driver is a family, yes.
Do we know how the lawyer got it in the first place? Is it possible that there are other cases prior to him?
Well, that's the sort of the concept of community spread. Since we don't know where he got this, is it possible that he picked it up from another person who's out there? You would expect, based on the incubation period, that another person who was infected would probably end up in the healthcare system if they're sick enough. But as the governor mentioned, a lot of people get symptoms and they may not get sick. And this is why, you try to track it, it's a little bit hard because there may be others out there.
Here's another theory. Do you have a date or somewhere that you're going?
It's just the third of the day.
I try to talk to everyone because everyone has a somewhat different perspective. I spoke to one of the national, well, really international health official, who said, my theory is this. It has nothing to do with the time you started testing. That's an artificial line that you are drawing. That the theory was the coronavirus was here already, and people had it already, and it was spreading already, and people just didn't distinguish between the coronavirus and the flu, because you wouldn't without a test. And now that we're testing, we're actually finding out who had it already. And we're thinking, well, this all started when we were testing. His point is, no, we didn't wait for you to start to test. it may very well have been here and been spreading, and now you're just discovering it because you're testing.
So for all we know, this new family could have contaminated the lawyer's family, not the other way around. Or how do we know that, how do we know?
Who came first?
Yeah.
How do you know who came first
We do
between?
know by the symptoms, and not to get into the details of the patient, maintain patient confidentiality, but we do know based on the symptoms of when the friend who is the 50-year-old's friend, right, when he said to him, well, I think you're sick, or you have symptoms or something, so they had a conversation.
That's true. If you were symptomatic first, and I was symptomatic second, then the evidence suggests you had it first. We have to go. Danny has a date. Thank you very much.